Welcome. Thank you for joining forpay.org. This is Consumers Dr. Vangala. Today's topic, medical bills. Yes, medical bills. Folks, I keep saying that you can make lots of money in healthcare because there's a lot of wastage. There's a lot of wastage and prices are not transparent and folks tell you how much it's going to cost. But if you have a deductible with health savings, folks, you want to watch out every penny, yes. Today I'll talk about how to lower your medical bills. It's an interesting, and in fact when you do the medical billing charges before you even get into the hospital or get in touch with your doctor, you need to know, I would strongly advise you to subscribe to a healthcare blue book. It may be available online for free, healthcare blue book. And the prices vary, folks. Prices between the hospitals and the labs and the doctors, they vary a lot. So there's no way to standardize. It's like anything else, folks. It's like any shop for something. You have to look at the prices. Same thing in healthcare. Before you get in touch with your doctor, you need to know, especially with COVID, a lot of people are talking to their doctors on telemedicine, telehealth, teledoc. You need to be aware what the charges are. First, you have a deductible, so you're paying cash. You can as well say, I'm paying cash. There's no reason to even give your insurance upfront because you're responsible for the payment. The reason why I say that, if you say cash, the charges are a lot more reasonable because, as you know, once you say insurance, they literally, upcharge everyone, upcharges if you have insurance. Like anything else, folks, it's nothing unusual. If you have if you have an accident, you have insurance, they think they have deep pockets. That's the way it is, even for doctors. They know they have $1 million coverage, they have the deep pockets. This is where the insurance gimmick starts in healthcare too. So you're paying cash. So once you know, and when you look into the healthcare blue books, there are charges by the zip code, by the area, by the doctors. So you have an advanced idea how much it is, and you can call them and say, how much is it? And you're paying. And keep all the receipts, folks. Keep all the receipts. Very important. And there are ways to save money. Even when the doctor sees you, whatever, the 15-20 minutes, and basing on the time, they may charge you basing on the time. And the other thing is, you need to know which lab they use. You need to know which diagnostic center uses, which hospitals use, because some of these physicians are affiliated with hospitals. There's a rule. Hospitals cannot control the doctors. It's called kickback. If your physician is referring to only exclusive to one hospital, there's a kickback rule. They cannot self-refer to the hospital because the medical group is run by the hospital. Medical groups are affiliated with the hospitals. Ideally, they're not supposed to do it, but they bypass all the rules, folks. So you need to be careful which network they are in, and you need to look at their network, which lab, and you can check. It's like any other shopping, folks. If you're shopping for it, you need to know where you're going and what you're buying. Same thing in labs. diagnostic center, x-rays, you name it, folks. You can upfront find out what do they follow their, ask them if you follow the healthcare blue book. And I'm paying cash because that's what I do, and I have a deductible, and I need to pay up. So they will tell you how much it costs. They have to. So that this is where the prices need to be transparent. Healthcare is really bad at not disclosing prices. I'm hoping things will change, and it is that way. This is a part one segment of the lowering the healthcare bills, medical bills, folks. I'll keep talking about it. I'll continue to talk about how to save money and make money. It pays you back. That's what the forpay.org is all about. You have a deductible, you use it wisely, and you have a health savings. You're saving. You're not only saving, you're doubling, because your health savings is tied to the markets, like index funds. So you're appreciating your savings through your index funds, which you have a control. You have a control. I want consumers to control. So every penny counts. Like anything else, folks, you need to watch out like a hawk. If that's what you do, there's lots of money to be made, man. There's lots of money to be made in healthcare, because healthcare is so, there's a wastage of money. That's where the costs keep going up. Rising healthcare costs are because, once you give the insurance, the insurance premiums go up because your insurance card is being misused, and the insurance companies, they don't care if there's insurance costs. They're getting the money from you guys. So that's the way to control your medical bill, folks. I'll be talking more about how to save money in healthcare. And thank you for listening. If you like the topic, hit the like button, subscribe, share, and make some comments. We will see you next time. Goodbye and God bless.